Someone asked this question that you're looking at on the screen, which read, what is the correlation between change in prescription power and progressive myopia? This question is one of the concerning questions most myopic patients ask, and most of them up till now are yet to know why they usually have to change the power of their glasses annually or whenever they visit the hospital for glasses review. So in this video, I'm going to be answering this question or explaining why this occurs. Stay tuned. Hi everyone, welcome to Seeing is Living, where you find vital information about your vision, sales of vision products like frames, sunglasses, protective lenses like blue cut and photochromic lenses, as well as contact lenses. If you're just watching me for the first time and you are yet to subscribe to my YouTube channel or follow me on my social media handles, kindly do so, as this might be the best decision you have ever made for your vision or your eyes. Having said that, let's go straight to business. There are two types of myopia: refractive myopia and axial myopia. Now, refractive myopia is a type of myopia that occurs as a result of the front part of the eyes being too curved or too powerful for the light entering the eyes, and this makes the light entering the eye to land in front of the retina instead of on the retina. I know what you'll be asking, what does it mean for the front part of this eye to be powerful? First of all, this front part of the eyes I am talking about is called the cornea. Now, the normal strength or the power of this cornea is plus 44 diopters. So anything that exceeds that 44 to 45, 46, depending on the curvature of the eye, makes this person to be myopic. For this front part of your eyes called the cornea to be able to bend light properly, your doctors will give you minus lenses in order to reduce or weaken the strength of this cornea so as to make it to bend or refract light properly, like a person without any refractive error. Another type of myopia is axial myopia, and this is the major cause most myopic patients usually need to change or wear a different power of prescription every year or every 2 years. This type of myopia is a type of myopia that develop as a result of the length of the eye being longer than normal. Now I'm going to use this rubber band to represent the eyeball. The normal length of the eyeball is 24 millimeter. However, when a person is born, the eyeball is less than 24 millimeter. It's about 17 millimeter. When the person gets to adult stage, the length of the eye will grow from 17 millimeter to 24 millimeter, and at 24 millimeter of length, the eye is supposed to haunt or stop growing. Unfortunately, to some persons, the length of their eyes will keep growing or stretching, making it to be 25, 26, 27, even up to 30 millimeter. The only thing that exceeds 24 millimeter becomes an abnormality, and this will make the person myopic because it will cause the back part of the eyes or the light sensitive part of the eyes to be further away from the front part of the eyes. Now, this is what I mean by the axial length. Axial length simply means this distance between the front part of your eyes to the retina. Now, when your eye stretches from 24 millimeter to 25 to 26, it means that from the front part of your eyes, where light will enter, then pass through the cornea, the crystalline lens, before it will get to the back part of your eyes, will be farther than normal. This will make light entering the eyes to land in front of the retina, because the retina where it's supposed to land is farther. I don't know if you guys are getting what I'm saying. Okay, let me break it down. For those of you that are living in Owerri, let's say you're at Cherubim Junction and it's at night and you want to shine torch for someone at Orchard Pharmacy. You know that when you put your light on from Cherubim Junction, pointing it straight to Orchard Pharmacy, people that will see more or better are people staying close to that Cherubim Junction. A person at Orchard Pharmacy, before the person will see with the lights that we are shining from Cherubim Junction, the light will already be faint, which means that it's only people staying close to Cherubim Junction that will enjoy or see better with this light that you are shining from Cherubim Junction. This is also what happens when the axial length of the eye is longer than normal. It means that when light is entering the eyes, before it will get to the back part of your eyes or the photosensitive part of the eyes, this light becomes faint or land in front of the retina, making it possible for only images at near to be clear, while those at far becomes blurry, because the back part of the eyes that receive this light is now further away from the front part of the eyes where the light is coming from. In order for this to be corrected, your doctor will also give you a minus lens. What this minus lens does is that it pushes the light closer or forward to the retina so as to allow it to land on the retina for vision both at far and near to be properly focused. There are people whose length of the eye or the eyeball keeps growing every year, which keeps moving the retina further away from the front part of the eyes, and this will result in change in prescription. This type of myopia, we call it progressive myopia. And for every 1 millimeter increment in the axial length of the eye will require an additional 3 dioptric power to be corrected. This is what I mean. Let's say, for example, before you were wearing -2 diopters. That was in 2023, and this is 2024. All of a sudden, you notice that your glasses can no longer help you. If you have axial myopia, the reason is because the length of your eye is progressively increasing, and probably it has added an additional 1 millimeter. Now, this 1 millimeter increase in the length of your eyes will require additional 3 dioptric power. This 3 dioptric power I'm talking about is the minus lens that will be given to you in order to push the light from the front part of your eyes to the back part of your eyes. So let's say you are wearing -2 diopters as at 2023. Now in 2024, because the length of your eyes has increased with 1 millimeter extra, now we are going to give you additional -3. Ignore the minus in the front of these figures. The minus is just to show that you are wearing a minus lens or you are myopic. And we are wearing -2 last year, and now with that -2 you can no longer see. Because there is an increment or a change in the length of your eyes with extra 1 millimeter, we are going to give you an extra -3. That 3 plus the 2 you are wearing will make it 5, meaning that you will require a -5 dioptric power or power of lens for you to be able to see clearly as we are seeing before. I don't know if this is clear. If your own is growing with an additional 2 millimeter annually, it means you will require 6 dioptric powers to correct this refractive error. That is why you keep changing your glasses, and that is the correlation between change of power of your glasses and progressive myopia. I don't know if I've answered this question. If you found this video useful or you have additional question you want to ask me concerning progressive myopia, please feel free to ask me in the comment section.